Okay, welcome back to our cerec modules. We spoke before about the home screen and everything that it does. We talked a little bit, if you come to this upper left, just for a real quick review. Click down, you can come over to configuration. You can look at your devices, the options for the program, as well as the parameters to set up. We're going to get out of there. So let's talk about what happens when a patient comes in. Pretty straightforward, pretty self-explanatory. We're going to come to Add New Patient, click on that. And you get to a page, and think of this as you're writing a progress note in your chart. So cerec is going to ask us for some information so it can identify this file and save it and store it. And if you happen to be sending something to a lab, it also identifies for the lab. So we'll just call this patient demo. We're going to get real original, D-demo. Date of birth, I typically would put the date that I am working on the patient. So let's just call this today, the 12th. Patient identification is not necessary. Putting the dentist name in is not necessary. These top three are necessary in order to build a restoration. Now, if you have 10 patients with the same name, or you would like to put an ID number, a chart number in here, you can. If you have multiple providers in your office, you can also put the provider's name in here. However, whatever makes it easy for you. But once you've given it enough information, you can tell it to add a new case, and you come to this screen. Nice screen. This is 4.0 software. Does a great job at helping us visualize everything. Now what you'll notice is a few things on this screen. First of all, if you come up to the top, highlighted in this goldish color is where we are. We're on administration. Right now we're telling cerec everything it needs to know to build the tooth. Once we have given cerec this information, we'll bounce to acquisition. What that means is we'll take some pictures. Once we've acquired the pictures, we can build a model. Once we've built a model, we can design a tooth, and all of these will become apparent as we move along the timeline. But the important thing to note is cerec really tries to help us identify where we are at all times by highlighting it. Now the other highlighted portion of the screen is restoration type. So right now is when we choose, are we going to work on a single restoration? Are we going to work on a multiple unit restoration? And hey, if we need some help, we can get some help here too. Let's just pretend in the moment we're working on a single tooth, which is highlighted right now. Let's call it a crown on tooth number 30. So I'm going to find tooth number 30. It'll highlight it and let me know, and I'm going to click on it. Brings us to the next screen. So remember earlier on in a past module we talked about, is it a crown? Meaning we have reduced all the cusps on the occlusal table. Doesn't matter how far we've gone towards the gingiva. It just matters, are there any cusps remaining, or have we prepared them all? If we've left one or more cusps, we would highlight inlay onlay. But let's stick with crown. Now, this is where cerec starts to get fun and where you actually start making some decisions as a clinician. So there are three design modes you can choose from. Biogeneric individual, and by definition what that means, and this little diagram is a little helpful hint, is we are going to tell cerec to use our patient's other teeth to build this crown. The reason we've got this little arrow that loops is what cerec is going to do is, in this instance, because we're building number 30, it's going to look at tooth number 31. It's going to say, where are the cusps? How does the buccal lingual contour look? What are the mesial distal dimensions? Is the anatomy very extensive? Is it very shallow? And it's going to use tooth number 31 to design tooth number 30 for us. So the software is pretty much building our entire tooth, at least initially. biogeneric copy, now we've only got an arrow on one tooth. What that means is it's going to use the pre-treatment version of number 30 to build our new number 30. So it's not going to look at other teeth in our patient's mouth. It's only going to look at the tooth we're working on. Biogeneric reference is going to look at any other tooth in the mouth that we decide. So for instance, if we were working on tooth number 30, we may decide that we don't really like the way number 30 looks, but we like the way number 19 looks, and if we could build the mirror image of that, that would be a nice restoration for our patient. So we've got three major design modes to operate from in cerec software. Now what I can tell you is there are advantages and disadvantages to using each mode. So we choose the mode that makes the most sense on whatever patient we're working on, given the clinical situation. Real briefly, a couple examples. When might you want to copy a pre-existing tooth? And what I'll tell you, as far as taking pictures, making images go, biogeneric copy requires the least amount of images. So one of its strengths is that you are in and out of the patient's mouth very, very quickly. That's one of the big positives of it. So when are times when I might want to use copy because it's fast? I want to use copy if, for instance, I'm working on a tooth that maybe I'm sectioning off an existing crown. Maybe there's recurrent decay on a PFM or a full cast crown, but the contours look great. The bite looks great. I'm not worried about copying anything bad because everything looks exactly the way I want it to look. In those instances, biogeneric copy is fantastic because if I take a picture of tooth number 30 that looks terrific, and then I make my preparation and I take another picture of it, biogeneric copy simply means it's going to build me the identical tooth that we started with. So fast and easy, I like it. Another reason to use biogeneric copy is if I am trying to build tooth number 30 and it happens to be an abutment for a partial. So maybe it has a rest prep, maybe it has guide planes, it has the ideal contour for the retentive arm, the reciprocation arm. So imagine I'm building that tooth. If I used another mode, if I used biogeneric individual, and I was building my new tooth number 30 that is an abutment, but it's really looking at tooth number 31, it's not accounting for all those things that are in that pre-existing crown. So I like this an awful lot if I am rebuilding a tooth that is an abutment for a partial. The last place I like to use it is if I'm working off a diagnostic wax-up. So what you'll see in dentistry is your most valuable time is your chair time. Anything you can do in preparation for that chair time makes life really, really easy and helps you to become really efficient and really effective with your time. So if we are working on multiple teeth, say it's a quadrant, you know, we're working on 28, 29, 30, and 31, or I'm working anteriorly, you know, 7, 8, 9, 10, 5 through 12, whatever the scenario may be, there is a significant advantage to me having my lab wax this case up and then me taking pictures of my wax up just as if that restoration was already in my patient's mouth. And then all I need to do that day is come in, shape teeth, and take pictures of my preps. Again, it's really fast, it's very efficient. So those are a few of the big reasons why we choose biogeneric copy when we choose it. Now I can tell you that might be a third of the time. The remainder of the time, with very few exceptions, we're working with biogeneric individual. And we are allowing the software to build teeth for us. So any single tooth, any 30, 31, 29, 30, you know, 2 teeth at a time, badly broken down teeth, whatever the scenario may be, 70% of the time we're working in biogeneric individual. But the key to this page is to know full crown, partial crown, which design mode, and then once you've selected those, if you come down here, it's going to give you the chance to select your material. Just like everything else you've seen in dentistry, there are multiple companies that do the same thing. So Sirona, who is the manufacturer of cerec, has blocks that can be used. Whenever they're highlighted, you'll come down here and it'll show you what they have. So Sirona's highlighted. It means we've got cerec blocks and we've got cerec PC blocks. If we go to Vita, Vita's got a little bit more of an extensive line. They've got Mark II, Trilux, Trilux Forte. They've got temporary blocks and multicolored temporary blocks. And we'll go through materials in a later segment for you, so don't worry about it now. Just suffice it to say that these are important things to know when you are at this stage of designing a tooth. Ivoclar. Same thing. Ivoclar has multiple blocks to restore teeth. They also have a temporary block. Mertz makes a temporary restoration, and then 3M SB makes a composite block, and they also make a zirconia-based block. They're coming out with a temporary restoration as well, so you'll see them add more blocks as time goes on. But the crux of this page and the last page is to define the restoration. Is it a crown? Is it a partial crown? What mode would you like to use? And hey, what kind of material would you like to build that crown out of? So that's enough for today, and we'll see you back here next time. Thanks.